Pleasure to welcome such amazing people at this event, organized by our association IRIFIV-AISRG. The reason why we're gathered today is to announce the first action of our group, and is to organize, in partnership with the College of Gynecologists and Obstetricians of the Great Britain, a self-assessment about the practice of ART in laboratories and the quality assurance of the IVF labs. It is with a great honor that I introduce you to Dr. Zarqawi, who is one of the founding members of the group. He currently chairs the IRIFIV-AISRG Association in Morocco. He is also a member of the board of the Moroccan Society of Fertility and Contraception. He is also director of the IRIFIV Assisted Reproduction Center. Please welcome Dr. Muhammad Zarqawi.
Bonjour chers amis et collègues, c'est grâce à vous tous présents ici que j'ai l'honneur de présenter et de présider cette nouvelle entité scientifique à visée internationale. Donc tout est parti d'une idée. Cette idée, c'est de faire de nos données et des observations qu'on a, des articles scientifiques, de les partager avec les autres équipes. Et grâce au travail et à la passion de tous nos amis présents ici et en Angleterre, qu'on a réussi à mettre en place cette plateforme de travail collectif.
Hello, dear friends and colleagues. It is thanks to all of you present here that I have the honor of presenting and presiding over this new scientific entity with an international purpose. It all started with the idea of making articles of our data and observation and sharing them with other teams. And thanks to the work and the passion of our friends here and in England, we succeeded in setting up this platform, which will be the base for collective work.
On va commencer par remercier tous les amis qui sont présents et surtout Dr Sadani, qui est fondateur du premier centre de PMA au Maroc et scientifique dans l'âme. Il est là-bas mais il se cache. Donc, bien sûr, Dr Longi, qui est cofondateur d'IRIFIV et de cette société de recherche scientifique. Dr Monsif Ben Khalifa, qui est parmi nous et qui est un grand ami qui vient de Paris et qui est un grand scientifique qui nous a toujours soutenus, et conseillé par sa présence et sa grande connaissance scientifique. Dr Yaqub Khalef, eminent doctor, eminent scientist and humanist, was one of the main support. We would like to express our gratitude to Dr. Marcus Steven and Sarah David from Royal College of Gynecologists and Obstetricians in United Kingdom for their continued support and ideas to make this entity reality. Nos amis et collègues ici présents qui ont tous travaillé avec nous et grâce à eux qu'on avance tous les jours, et les techniciens et les embryologistes de notre centre IRIFIV. Une mention spéciale pour notre ami Dr Mustapha qui a fait un travail formidable. Et ce travail, c'est pour la mise en place et la réussite de cette plateforme. Comme vous le savez, on traite l'infertilité. L'infertilité est une pathologie complexe multifactorielle qui nécessite bien sûr de travailler avec différentes spécialités, la médecine de la reproduction, la chirurgie, la radiologie, biologie et d'autres. Et pour bien traiter ces patientes, tout passe par l'excellence, dans l'analyse et dans la pratique. Ceci nécessite un travail de groupe, un travail collectif et le partage des données. Ce partage des données qui, avec les observations, c'était un des objectifs premiers de notre plateforme.
We treat complex multifactorial pathological infertility, hence the interest in working with different specialties as reproductive medicine, biology, urology, radiology, and surgery. Treating these patients well requires excellence in analysis and practice. This requires a collective work and the sharing of data and observation, and this is the objective of our platform.
Alors tout ça passe par une première étape. La première étape, c'est passer un examen international, programmé le 10 octobre prochain, qui va être un examen renouvelable tous les ans. Et pour se situer par rapport aux connaissances actuelles. Donc ensuite on proposera des formations ciblées en médecine de reproduction, au laboratoire, donc au bloc opératoire pour la chirurgie de l'infertilité. Les publications resteront bien sûr un pilier important dans le travail qui nous attend. L'objectif final sera d'améliorer nos résultats et de rendre service à nos patientes, bien sûr, et à nos patients.
The first step will be an international examination held the 10th October, renewed every year to situate the patient in relation to updated information knowledge, followed by target training in the laboratory or operating room for infertility surgery. The publication will remain an important pillar of the work ahead. The ultimate goal is to improve our results and to be of the service to our patients.
Thank you very much, and now I would like to introduce Professor Khaled from London, who has been with us since the beginning. Thank you very much. Thank you, Professor.
It is my great pleasure now to welcome Professor Khaled. Mr. Khaled is a recognized international expert in management of infertility and assisted conception. He is currently the medical director of the assisted conception unit at Guy's and St. Thomas Hospital and director of the pre-implantation genetic diagnosis program. Together with his ACO team, he has been helping many couples fulfill their dream of having children. With his past experience in the field, Mr. Khaled has lectured at major national and international conferences and also published widely on all aspects of assisted conception, in particular fibroids, ovarian stimulation, and IVF. Please welcome Professor Khaled, who is present with us online.
Actually impressed that you are dedicating your time and effort to try to improve research, and it could not be more comical. Because what people cannot appreciate that research, I'm not sure about different branches of medicine, but research in reproductive medicine in particular is becoming controversial because there are so many studies and not all of them will attract the credibility that it requires. And I will strictly speaking, we'll be talking about my part of what I do in reproductive medicine and cite examples as to what we can and can't and or shouldn't do. Okay? So if I just share my presentation, share. This is Can you see my slide?
Yes. Yeah.
Okay. So it is talking really about what is helpful and what is not. And in the process, challenging few traditional concepts to research in reproductive medicine, and they can be extended to other parts of medicine. But as I work in ART and reproductive medicine,
I would like to give a brief introduction and talk about research and ART and what is so special about ART and what is the ideal research conduct in a pragmatic way and the common mistakes that people commit or pitfalls that they undergo. Now, when we talk about ART, it has become an essential part of medicine.
Excuse me,
it's not a,
can you take the blue one, please? We have a...
You have two presentations?
No.
Sorry?
No, in this one. This. Non, lui, il la voit pas. Si, là, c'est lui, il faut qu'il mette que c'est compris. Non. Ah, c'est nous, on va le faire. Okay, it's good. Now it's good. Thank you.
Can you see me?
Yeah.
Okay, so it is being used not as a last resort, it is mainstream, and patients have different prognosis are being treated, and some may have genuine infertility, but most of them will have relative infertility. So I ask you all, why do we do research? The official line is, we do research to explore new ideas and explore new horizons. And we develop novel solutions and try to prove that they work. And it is dangerous to have preconceived ideas. We should examine whether they work rather than try to prove they work. And there is a mega difference between the two approaches. And officially, we pretend that we are doing research to solve unresolved problems and find new problems. But what has been happening so far can be described unofficially that we do research to publish papers and to travel to conferences in nice places and get entertained and dined and enjoy that bit of privilege. And we do research to try to attract funding, because funding agencies normally will not spend their money with people who don't have track record of research. To try to create new systems and solutions to get more funding. And of course, all of us would like to have a good CV and secure an academic job and maybe impress other people, including our parents and our family and our friends. We are really so important, and we publish and we do research. So when it comes to ART and research, it presents a suitable setting. Why? Because we measure how long the patient has been trying. We measure their egg reserve. We measure how many eggs we get, how many embryos we get, pregnancy, live births, etc. And we always exploring new treatment and intervention. And there is extensive commercial pressure. There are products being promoted and interventions and tests. And if we are not aware, we can buy into these things without assessing the conduct of research that underpins those interventions. And there is a media and there is patient demands. All of that is playing a part in research. When we do research in infertility, we must appreciate that patients who have delay in conception usually have relative reason. And sometimes they get pregnant on their own while they are prepared for IVF or after IVF had failed. So there is a rule for chance or serendipity, and there is lack of research appreciation. People just try something and they feel that it made some woman pregnant. Let's use it for everyone. And unfortunately, not all clinicians are trained to do research or interpret research or even assess what is good from what is not so good of what they read. And there are attitudinal issues. Some people, they feel they have divine right to publish and to do research when they may not be equipped. And sometimes also, there is scarcity of resources. People don't have resources, but they still would like to do research. And sometimes that leads to cutting corners. So serious research is expensive. It requires significant and sustained investment in these resources. It requires time, dedication, access to information, laboratory space and facilities, equipment, technical and administrative support. What is also important to appreciate, if you think research is expensive, try disease. If we stay without solutions, we are paying even more expensive price than the investment we make in research. So nothing is more expensive than a missed opportunity. If we have an opportunity to do proper research that help our patient and patients globally, then this is a good opportunity. So the choice when we practice ART, we practice is based on evidence. So we need to have evidence and we need to conduct robust research to generate it. Or we are happy with anecdote-based practice where anything and everything say that is just whatever in the market and the patient asks for, you will give. And this will give you the freedom to do whatever you like. When we practice evidence-based medicine, we have confidence, our conscience is clear, we have commitment to the medical oath that we take after graduation, that we will not do harm as a first priority. We will show professional leadership, and we will hopefully lead to improved outcome and safety and effectiveness. When we talk about this based practice, the anecdotal based practice, it is potentially misleading and potentially harmful. I can give examples if you would allow me later, but I know time is limited. It is harmful medically and financially. It's not good for progress because we're not getting objective evidence. We're just doing it and continue doing it ignorantly and greedily. It undermines our professional commitment to what is best for our patients. We are committed to what is best for us, but not for patients. And also we suck up to the commercial prejudice. This is the ideal scenario. You were talking about making observations earlier. When we make observations, we record or observe what do I see in nature. This can be from one's own experience or source or reading. Then the challenge is to think of an interesting question to ask. Why does this pattern occur? That's a reasonable question. And then you have a hypothesis that you would like, yes, you would like to test. And then develop testable predictions. And when you do that, you test it properly and objectively, you will come up with a specific answer. After that, you will gather data to test those predictions and to develop general theories. So that is the right format, but not truncate from making observation to applications, which is not the best way of doing things. I give you an example. A few years back, maybe now 7, 8 years, maybe more, the world was taken by storm about that intervention called endometrial scratching that still some people practice. Why? Because somebody did it and it resulted in a pregnancy. So the whole world started doing it. So in order to address this question comprehensively, you see from the authors of this paper in New England Journal of Medicine, after 5 years of work, there are 5 countries involved in this and 5 research groups from the United Kingdom, Australia, New Zealand, Sweden, the Netherlands. All of that try to ask the question objectively. Does endometrial scratching really improve the IVF outcome of IVF? And when you do research properly and you have the right number, look at the live births, which is the outcome that matters. There is not the slightest difference between those who had the scratching and those who didn't have the scratching. And we're talking about 1,400 patients being studied. So what is helpful is to do research only after you have received adequate training. You understand the context. You remain impartial. You don't go out to do research to prove your prejudice. You use appropriate resources. I can't overstress how important teamwork is, because you cannot do proper research as one or two people. In actual fact, when you publish randomized control trial with 2 or 3 authors on it, immediately it sends the alarm bells ringing that this is a botch job. It needs to have more members of the team to do a proper randomized control trial. Collaboration. If you can have a network of collaborators from the same country or even from other countries, then you are really subjecting your research internal peer review in addition to the external peer review that will happen when you publish. And you need to keep an open mind. You do not have to prove that the intervention that you are studying is effective. If you prove that it is not effective, it's just as valuable. At least you avoid people misleading patients by using it. Another example, where people use something called PIXI, or hyaluronic selected intracytoplasmic sperm injection for selection of sperm for ICSI. This is a study that we published in The Lancet after 5 or 6 years of work. It is multi-center randomized control trial in the UK. Everybody was thinking the idea is, if using the HAP select or the hyaluronic acid mounted plate, you will select the best sperm and you will improve the result. We didn't find that. So when you conduct a research project, first of all, you need to do scoping. What is the problem? What is the priority? You assess existing research. And if there is gap, then you need to address it. And some people resort to systematic review of the existing evidence before they do research. But it's important to do it in a clever way. You need to crystallize your research question, identify the primary outcome and secondary outcome, and use proper research methodology. If you wanted to know about a topic and the priorities and what is happening, there is a very famous website called the James Lind Alliance website, where it addresses those issues and identify areas that are important and the top 10 questions that need to be asked. I give you an example of miscarriage. This website is accessible. You can go to it and see what is the thinking in this particular area on that website. So it's identified the top 10 questions that need to be asked at the time of picking this up from the website. Preterm births, what are the top 10 questions? They are all there. So you can pursue them using or utilizing the privilege of having this good group or patient or website making life easier for you. Sometimes we make a head and tail of a study that involves studying 20 patients in each arm. You will be mistaken because you cannot make inference from 20 patients. Just make no mistake. When you read an abstract saying we studied 25 patients in each arm, you need to really be clear that this number will not be adequate for any clinical trial. And consider, when you make your sample size, consider the dropout. Studies that tells you that we started with 200 patients and we ended up with 200 patients for evaluation are lacking credibility because that's not real work. Consider multi-center collaboration for large sample size. So what is very helpful is to get guidance about the proper conduct of research. Now, I can't recommend highly enough a practical guide to health research. And that is published by one of the most eminent, experienced, wise people on earth in medicine and in reproductive medicine and in global health, who happened to be my privilege to have been one of his students. Professor Mahmoud Fathallah worked for the World Health Organization, and if you put that title in Google, you will get a comprehensive research document to to give you the essential for how to do proper health research. It is available for free. It is a Word document and you can download anytime you like. What is not helpful though is taking the wrong approach, suggesting that research, what is research? Anyone can do it. That's wrong. Not anyone. It requires dedication, knowledge, training, everything of what I mentioned. It requires training, understanding, consultation. If you don't have those elements and you have preconceived outcome in your head that you are set to prove, you are doing the research wrong and you will be found wanting. Things are becoming tight nowadays. Doing away with proper methodology. No, proper methodology is indispensable. So the advice is don't cut corners to make it convenient, because if you cut too many corners, you will lose your edge, the edge of your research and its impact. So I hope I have not taken much of your time. My conclusions are clinical research is important and good clinical research skills are acquired, something you can be trained to do, as long as you have the appetite and the aptitude and the belief in the importance of the research that you do for the benefit of humanity, for the benefit of patients, not to further your career only. It can further your career and benefit people. Research training and resources are essential. Research planning and monitoring are important. You may have noticed now that people, before they embark on a trial, they publish the research protocol on any journal so that they can get the benefit of peer review before they embark on research. Peer review is extremely helpful. Cutting corners undermines research quality. Research under pressure also can be compromised. If you have demand on you to provide certain number of papers, you could stray and not do proper research. And that is my contribution. Thank you very much for your attention.
Thank you very much for this excellent presentation for us. We begin the research health scientific, and we are very glad and happy to learn for your experience. Thank you very much.
We all learn from each other. Learning, we all have to be trained. We still are learning, and what you are doing is admirable, because many people are busy with the commercial side of it. You are busy with the scientific and ethical side of it.
Thank you very much. Thank you.
It is now my great pleasure to welcome Dr. Munji, who is a graduate from the University of Strasbourg. He has been managing the Laboratory of Clinical Analysis and Reproductive Biology LaboMac since 1990. He became a founding member of the first fertility and assisted reproduction center in Morocco in 1992, IRIFIV Center. Then, founding member of the Moroccan Society of Reproductive Medicine in 2014. At the same time, he developed his medical analysis laboratory, LaboMac, and oriented it towards scientific research in the field of biology and reproduction in partnership with various Moroccan institutes and universities. Please welcome now Dr. Munji.
No need to come back on the objective of IRIS research already today by our chairman, Dr. Muhammad Zarqawi. But the main purpose of our group remains promoting and encouraging scientific research among public and private fertility centers and clinics in the area of reproductive medicine and fertility, endoscopic surgery, endometriosis, clinical embryology, andrology diagnosis for male infertility, and all laboratory techniques related to assisted reproductive technology and quality assurance in IRIFIV laboratory. All of us attended several scientific meetings and congresses and workshops and have multiple scientific papers readings, and all that leads to a certain amount of data gathered along the year. And the idea for this exam, behind this exam, is to validate this knowledge in all disciplines cited above by an assessment, annual assessment. Therefore, we thought it will be better if this assessment is converted in an accredited certificate, which we have made. This accredited certificate, who is done by European Union of Medical Specialists, who is known internationally for learning pay program accreditation. Also, we were surprised by enormous request for this annual evaluation, with more than 3,000 registrations over 45 different nationalities. It is therefore encouraging to renew this exam according to an annual schedule, as said by our chairman, Dr. Muhammad Zarqawi. One word about the exam. The exam is consists in two whole exams. The first whole is for physician and gynecologist, and the topics will be the doctor will be examined on reproductive medicine, on the endoscopic surgery, on endometriosis, on assisted reproductive technology practice. And the second whole will be for embryologists and biologists, medical biologists, and they will be examined on all techniques, embryology techniques in the lab, in IVF lab, and security insurance in embryo culture, and all details according to success, IVF success. Also, this exam has been designed to reassess medical students that have been taught in a way that neglected the importance of fertility during their academic years. I am thinking about our university in Casablanca. There is no infertility teaching program. As I said, I think about our universities. There is a little program in infertility, and there is a need. The program, the platform like us, like that, for updating their learning and to higher level in infertility medical practice. Finally, I would like to take this opportunity to place on record our hearty thanks to Professor Khaled with his huge experience and huge learning. Professor Stephen Marcus, Dr. Sarah David, Professor Mansour Khalifa, our support, Dr. Muhammad Zarqawi, our chairman, and also I have extend my thanks to all the team of IRIFIV-AISRG group, especially Mustapha Zakaria, as well as the team of IRIFIV centers here present, with their enormous cooperation and organization for this event, and thank you.
It is now time to welcome the Professor Ben Khalifa. He is a professor of reproductive medicine and developmental biology at University Hospital and School of Medicine, Picardy. He is head of reproductive medicine and genetics in IVF lab at University of Amina. He is also our honored guest. He will be introducing all the IRIFIV-AISRG group and IRIFIV Center, and will distribute the awards of honor given by the Royal College and Gynecologist and Obstetrician from the UK. Please welcome now Professor Mohamed Mustapha.
Thank you very much, ladies and gentlemen. Today, for me personally, it's a great day. For the IRIFIV team, as the first reproductive medicine centers in Morocco. This is very important because we should say the truth and we should know the history. The IRIFIV is the first reproductive medicine center in this country, and in my knowledge, even in North Africa. For that, I would like to thank all the consultant doctors for their engagement, and also all the scientists, clinical laboratory medicine doctors, embryologists, and the other members of the teams. What I would like to say, you can see that Morocco is taking the leadership via this initiative.
from IRIFIV groups. That's, you are showing that there is a real potential collaboration between the North and the South. From the North, from UK, having the great support from Professor Khaled, eminent doctors, eminent scientists, and real humanists. This is very important. What's the doctors? In medicine, the doctors is a scientist educated to the, doctors is a humanist educated and trained to the science. And the Professor Khaled is a typical schema of this. Also, with the support of our colleagues, Steve Marcus and Sarah David, via the Royal College of Obstetrics and Gynecology in UK, and also with the full support of my School of Medicine and Jabir University in France. That's, we are in the north, and via Morocco, and via this initiative, we are supporting the south, mainly North Africa and West Africa. That's clear. Now, this is the great potential for training and education and scientific and technical support. On behalf of my colleagues, Professor Khaled, Steve Marcus, and Sarah David, and on my personal person as Professor of Medicine in the University of Jules Verne, I would like to know and to honor all the members of the IRIFIV for this initiative. And thank you very much. And now we will go person by person. I will ask Madame Zarqawi to come. The president of this project and this initiative is Dr. Muhammad Zarqawi as the president of the association. Thank you very much. Thank you. Congratulations. We are so happy. Thank you. We will go to the second members of this initiative. It's a little bit difficult to talk to me about this person as Nuruddin Walji. You know, I mean, he's not a colleague, he's not a scientist for me, he's a real brother, and he's extremely engaged. He never blocked any request to support people to know what's happening in the IVF laboratory. And I would like to thank you personally for your engagement and your generosity to support the scientific community for that. Thank you. We go through the members. I will ask Dr. Mustapha Zakaria to join us. Thank you. Dr. Zakaria, we didn't have the chance to talk a lot together, but I know how much effort you are making and how much you did to make this initiative successful. Thank you very much. And you are making Morocco visible through the international network. Thanks for your effort. Thank you very much. Thank you. I would like to ask Dr. Muhammad to join us. You know, this guy, he is a very discreet guy, but in my experience, you never need to repeat to him the same things twice. That's me. We are so happy to have you as a senior embryologist in the IRIFIV and extremely involved to make the success rate more suitable for the Moroccan population. And also I know that you are supporting a lot the West African IVF centers for the training and education. Thank you very much for what are you making to the community. Now, we will ask, let me say, our grandbrothers, Dr. Ibrahim Saadani. I think all of us, we learn something from him. What I can say, that's Dr. Ibrahim Saadani, he trusted me personally when I was young student and young fellow, and he was always giving me the good advice as a person, and also he was always support me for the scientific idea and the scientific collaboration. And personally, I will never say enough thank you to Dr. Ibrahim Saadani. Thank you very much. Now I will ask our consultant, Dr. Musalli. But I will tell you the history of this lady. I was a young fellow. I was in the School of Medicine in Clermont-Ferrand University. I was in the IVF centers. And this lady, she came to our department to be trained in IVF. I think the young people, they was not born yet. And you see, we are still here together. Huh? You left us, and we was, you said, okay, I will not stay in France. She refused to stay in France because I remember very well, Professor Jean-Luc Pouly wanted to keep her with us, but she said, no, I want to go back to my infertile couples. And you see, thank you very much. God bless you, and we love you. We love you. Now I will ask Dr. Hissan to join us. I'm talking the junior one, not the the founder of IRIFIV. I saw him this morning in the clinic, but probably he will join us later. Can you take it? Now I will ask the young generation of the consultant, Dr. Sanhaji. I know that you are doing the best to keep, this IRIFIV growing and improving. And I think you will be the next people who will continue the development of IRIFIV, and please continue to support the scientific and the clinical initiative. Thank you very much. Thank you. I will ask our colleagues, Dr. Azali. Azli, sorry. We are not meeting each other often when I'm here, but I know what are you doing also and how you are collaborating with the centers. Please keep going on. The infertility is a major problem in this country, and we need engaged people to help the infertile couples. Thank you very much for your support. She was growing in the department. Nobody is perfect, but embryologists have this difference. We know each other since many years, and you support us also. I remember very well when I asked you to go to Montreal to support our IVF centers, and you was there. It's only to tell you that fertility is growing very well. We are opening the new centers, and we will never forget your support and your engagement in the embryology laboratory. Thank you very much. Okay, take care about you and continue your engagement. We ask Dr. Mustapha to join us. Abdul Jalil. Now we are asking the young scientist, Dr. Malach. Malach, she's very promising young student. She has her master's in biology, and she came to IRIFIV to do her PhD, and she's doing a great job. Please continue to do it, because to be good embryologists, we should be good scientists before. Okay? Please be scientists. I will tell you the history of this guy. We met each other in Paris, in Necker Hospital. He was working as a PhD, and as I have the chance, I have the double qualification in embryology and genetics, and we was talking with him, and he was extremely, in his early age, to be involved in cytogenetics, genetics and molecular diagnostic. And I would like to thank you. You trust your country, you came back to this country, and I remember 12 years ago when Dr. Lwangli asked me to develop the genetics department in Labomac and IRIFIV. You was the first person who support us. You train people, and thanks to your support, 2 PhD people get their PhD in IRIFIV. Dr. Aisha Matkour, now she's a scientist and professor in Rabat, and Dr. Ismail Karouche, now he's the senior embryologist in the second IVF centers of Labomac groups. I would like to thank you very much and for the full support. And each time we ask you to come here, I remember in this lab when we was in trouble to read the slides, you came and we give the result. Thank you very much. And please continue. I will ask Dr. Yasmine Smith to join us. As you know, Dr. Yasmine Smith, she's very discreet, but I know she's working very hard. First, by going to Spain to study, going to Senegal to study, managing Labomac, and managing the family. Probably, what I can say, you are more engaged than the fathers, and I'm sure you will make the future of Labomac successful. Please trust your people, support your people, please believe in science, and you will get the leadership. The future of the humanity is women. And this is why, please continue.
Pardon?
Thank you.
Thank you.
Now I will ask Jabir to join us. Dr. Okay. Now I will ask Dr. Mehdi Barrada. Nobody is perfect, but also his. You are aware, but you are extremely involved to develop also Labomac International and Labomac Africa. I know that what I said, that's probably with this kind of initiative, Morocco is making the bridge between the north and the south, because the south, there is great potential of development, there is a great need for science and for medicine. Please continue to support the initiative, and I am sure you will make it successful. Thank you. Now we will ask Maryam Afef to join. Oh, Afif. Only after Maryam. I should make some history. She's the boss. She's the head secretary of IRIFIV, but she's bossing everybody. Why? Because she wants to make the things good and going on. And thank you very much for your engagement. Staying from Morocco to Casablanca, okay? Far from the family. Thank you very much. Wait.
I hope this is
You do?
for you.
For me?
Yeah.